Hello, everyone, and welcome to the Aplastic Anemia and MDS International Foundation podcast series. We're coming to you today thanks to generous support from individuals, donors, and our corporate partners, including Celgene. My name is Tricia, and I'd like to introduce Bob.
Hello, everyone, and I would like to introduce Nancy Corbitt by telling you a bit about an outstanding nursing professional. Nancy Corbitt has been an oncology nurse for more than 30 years, serving cancer patients while working at the University of Maryland Greenebaum Comprehensive Cancer Center, also known as AAMDSIF. In addition to providing direct care to patients, she has special expertise in education for both patients and staff, with several publications published, one focusing on psychosexual education for leukemia patients. For the last 15 years, she has assumed leadership roles in oncology nursing professional societies and state cancer-related initiatives. Nancy is passionate about providing quality, direct patient care and incorporating evidence-based practice into clinical workflows in collaboration with researchers. Nancy's efforts have been recognized. Nancy was invited to be a Cancer Moonshot Delegate in 2016, which was an initiative supported by the National Cancer Institute that aims to accelerate cancer research to increase the number of available therapies for patients while preventing and detecting cancer earlier. Recently, she has transitioned into the survivorship nurse Navigator role at Greenebaum Clinical Cancer Center, and is excited to serve as the cancer community in this manner. Hi there, Nancy.
Hey there. How are you, Bob?
Hello. Well, let's get started.
Sure.
We know you and others in your role have a huge impact on bone marrow failure patients and their families. So we'd like to ask you questions about the patient and caregiver experience, and would like to start with this question. That is, as you might expect, when a patient is first diagnosed, what is the hardest part for them? And we thought one question would be, do they understand the disease or even have a partial understanding of it? And do they, once they've come to understand it, do they understand the treatment options that are discussed?
Well, first of all, Bob, I want to thank you for having me. I really appreciate it. And I want to just say, I think it just depends on the patient. When a patient is first diagnosed with a bone marrow failure disease, a lot of times, number one, they're in shock. They don't understand, why is this happening to me? They're scared. They're not sure what's going to happen. There's a lot of what ifs that happen. So I think that there are those patients that will jump on the computer and look things up, which, first of all, I want to put out there, first and foremost is for patients to go to reputable sites to do any type of learning or scouting for information. And obviously, the best one out there is the AAMDS International Foundation. There's wonderful resources there. I think they use that to try and understand what their disease is. So I think you have those patients that actually go and look for a lot of information. And then you have the other set of patients that, are a bit in denial. They don't even want to talk about it. They don't want to even think about it. As far as treatment options, I think, again, they look at the internet and they're looking to their friends and their family. But I think the best thing is for them to be able to get in to that doctor's appointment first and be able to become prepared for that appointment. And when I say prepared, I want patients to think about what questions they want to ask the doctor ahead of time. Some of them would be, what exactly is my diagnosis and when would I be starting treatment? And then what are the treatment options? Are there more than one? Are there different options for my particular disease? Are there clinical trials that I could join? And what are the benefits of those treatment options? And also, what are the side effects? that they can have. Does that answer your question, Bob?
Yes, actually, you got into my next question, and that was what types of questions can a patient ask their doctors or nurses? So, for example, to follow on that, could they be asking a nurse, someone like you, these very same questions?
Yeah, absolutely. I think they probably will ask several people. What as a nurse navigator, one of my roles is to help navigate patients and families through this entire system. And we want to, as healthcare professionals, we want to make sure that folks understand what's happening. They understand what their disease is, and they understand what their treatments are. And the reason for that is it's very important that if patients are having side effects, that they know what to expect from those side effects and that they can get back to the doctor and say, hey, I'm having problems with this medication and I wanted you to know about it. It's very, very important that patients feel that they can go back to their provider and ask them those questions.
Nancy, I just wanted to ask, does that mean that if a patient reports the side effect they're having, that the doctor can do something about the side effects?
Absolutely. And what we don't want is we don't want side effects to get so bad that we have to stop treatment. So it's important that patients let their doctors know when they're developing a side effect, because sometimes there's things that we can do to prevent any type of that side effect from happening, and then they can continue on with their treatment. So I think being able to have that open rapport with your providers, whether it be your doctor, whether it be your nurse, when you come in for your visits, the nurses will be asking you, are you having any side effects? And it's important that you let them know before they get worse. And here's an example. Let me just give you a little bit of an example of one. There are some medications that can sometimes cause side effects called what we call peripheral neuropathies, and that is tingling in your hands and your feet. And what we don't want to do is we don't want those side effects to get so worse that it interferes with your daily activities of living, meaning you can't button your shirts. So there are things that we can do to hopefully prevent that. Sometimes acupuncture will work for that, sometimes giving you another medication. But what the important thing is that you realize that you should be letting your healthcare team understand to let them know what's going wrong.
Well, then to follow on, Nancy, I guess what you're saying here is that with a certain type of treatment or medication, there's certain side effects that can occur, but the patient and the treatment team really aren't going to know what might occur until something does happen. And it could be any number of things, I suppose, from what you're saying. So that's why it's even more important for the patient to bring up side effects.
Absolutely. I can't stress that enough. And I think that, there may be some patients that feel, I'm bothering my doctor, I'm bothering my healthcare team. Absolutely not. We want to know when things are happening. We want to know it early. I want patients to feel empowered to call their healthcare provider. If there's different ways to reach your healthcare provider now. A lot of times medical centers have patient portals. Utilize that patient portal where you can go in and you can email them besides making that phone call. So I think that's, I just want patients to come away understanding that we need this open communication. We don't want somebody to come in 5 days later and they're in severe dehydration because they've been vomiting for a couple of days and didn't let anybody know about it. I also want to just bring up, I think that it's really important that you define what your goals of care are. So what do I mean by goals of care? So what are your goals? Obviously, as a patient, you're newly diagnosed. What do you want to achieve? You want to get better. We know that's number one. But if there are certain things that are really important to you, and let me give you an example. Say you have your daughter's wedding coming up in 2 months, and you need to get treatment that is going to be continual on for, months. Let your provider and your healthcare team know about that so that they can try and work around that so that you can be there for your daughter's wedding. If that means giving your treatment maybe a little bit earlier or giving your treatment maybe a little bit later. I know that a lot of the bone marrow failure diseases, they need blood products. So making sure that you're, quote, tanked up before the wedding so that you're feeling good at the wedding. So be able to have that rapport, have that conversation with your doctor. This is about you. This is patient or person-centered care. We want you to be able to try to get through your life back to normalcy as best as you can. So again, laying out what your goals of care are and say, hey, this is really important that I really need to be here for this wedding. How can we do this and work together?
Thank you. Also, even if it's answered in lay terms, some of the explanations that a doctor or nurse may give a patient could be somewhat complex. And is there any problem with a patient asking twice, or can you explain this a different way if the patient is having trouble understanding the explanations and information they're getting, even when they're given in lay language, lay terminology?
Yeah, absolutely not. I think that is very reasonable. Again, we're talking about you. This is about you, the patient. So asking that, understanding that, there's actually a method called a teach-back method that healthcare professionals should be using. And what I mean by that is after we give you some information, many times we will say to you, can you repeat that back to me? And it's not to be annoying, but it's to make sure that we want to understand that you understand what we're talking about.
That's a great idea.
Yeah. So I think that you may find people doing that, and you may, but why do I have to repeat everything? Well, it's because we want to make sure that you understand what's going on. I also think it is very important to bring someone with you, if possible, to at least initially to your doctor's visits. Again, it's going to be overwhelming for you. So having someone with another set of ears to hear that, I think is very, very important. I also think that ensuring that you have a spokesperson for your family. There's some very big families out there, and one thing that actually helps to keep things streamlined and keep things moving along is to have one person as that spokesperson with you, or who asks questions for you. So if you have, again, a big family, identifying one person, and that will be very helpful in multiple situations.
Thank you. In a similar vein, we hear a lot. Well, let me ask you, in the current cancer treatment scenarios that there are, you always hear something about the healthcare team. Can you talk a little bit about, and it may vary from place to place, but what the roles are of the healthcare team, how many people there are, and what they do?
Sure. So I can only speak from working in an academia center. So I work at University of Maryland, which is a large cancer center. But many of even your community hospitals, centers have these resources. So you'll have your provider, which is maybe your attending physician, and then you may actually have a nurse practitioner or a what we call a physician assistant, and they actually will write some of your orders. And then sometimes if you're in a teaching hospital, you may have what we call fellows that work along, and there are doctors who actually have decided they want to go into oncology, so they are working along with the attending. And then you're going to have your clinic nurse, and then you're going to have your nurse that is actually, if you're going to be getting an infusion meaning like IV chemotherapy or IV medication, that would be an infusion nurse. So you may have that. And then you'll have like what my role is. And not every place has navigators, but there's some sort of a role that will just kind of help with care coordination, tying everything together for you. And that's a little bit about what I do. I do that as well as work with survivorship. The meaning of survivorship is every cancer patient is considered a survivor at the moment of their diagnosis. So we help you from the moment you're diagnosed all the way through your treatment and then post your treatment. And then you also have pharmacists that are on your team. You may not see those as much, but they actually really follow the medications that you're taking. And then generally there is a supportive care team. And what is a supportive care team would include a nutritionist may follow you. Social worker will be there to kind of help with different needs. And then sometimes there's other navigators within the system, and they would be patient navigators. So an example of that would be the American Cancer Society navigator. Some facilities have a representative right in their center, and then which we do. And then also we have a representative for the Allman Fund. And the Allman Fund patient navigator helps with the AYA patients. And that's the young adolescent population. Generally, they see patients that are 40 and younger. So you have a whole team that is actually working on your care. You may not always see those, but they are definitely working to provide you the best optimal care that you can get.
So although the patient may not see them, the fact is they know about the patient, don't they?
Oh, absolutely.
And go ahead.
Well, again, like the pharmacist, I think is a big one. Every once in a while, you might meet the pharmacist that's actually on the team, but there's what we call clinical PharmDs, and they work right with the providers, and they really focus on the chemotherapies and some of the monoclonals, and just making sure that we're all on the same page, giving you the right medication to ensure your best outcome.
It sure seems that on this healthcare team, there's many roles, even up to 10 almost, and then there's the people who help on the support and emotional side of things.
Yes.
It divides up like that. Well, now we'd like to shift towards the caregiver experience. And you've spoken a little bit about how a patient may bring someone to an appointment with them just to listen and take notes or ask questions themselves. But caregivers have a big role in bone marrow failure disease, but it also can be hard for them sometimes. Have you seen and observed this?
Absolutely. Yeah, I think caregivers are, I don't even have words to say how wonderful they are. They're there to help you. They're there to provide you care. But we also have to think about taking care of them. There's something called caregiver burden, and it's just, it wears out caregivers. And so it's important, if I have any caregivers listening, that you realize that you need to take care of yourself. And I please encourage you, whether that would be taking time to go get your hair done, because you have to take care of yourself in order to take care of your loved ones. There's all kinds of support out there. I know that AAMDS has actually a lot of support on their website. If you want to go ahead and check that out for caregivers. There are support groups that are out in the communities that are just for caregivers. And once again, you're able to care for yourself, then you're able to take care of the patient. And I think one important thing I want to just jump in and talk a little bit about, and I think this is a good time, is advanced care planning. So the caregiver is going to be important in this, because having the patient, obviously the patient is always going to be in charge of their care. They should be the one driving what they want as far as their care. But having things written down is very important. And I always, with first patients, when I first meet patients and their caregivers or their loved ones, we talk about advanced directives or making decisions. Having that information written down is very important. So I would, as a patient, you want to ensure that you have appointed someone as your healthcare agent, whether that be that caregiver that's with you or someone else who you feel is trusted that would make decisions for you if you were not able to make those decisions that you would want them to make.
I wanted to go back a little bit when we were talking about treatment. Does a caregiver, what role do they have in the ongoing treatment phase in the patient's life and experience? And again, this goes back to side effects and identifying them and helping with that. Does a caregiver have a role in that specific area?
Well, yeah, and I think that this is why it's important to bring somebody with you. Absolutely. The caregiver is going to be able to maybe recognize a symptom or something even before you as the patient. And they will be the ones to say, hey, we really need to call somebody about this. And I'm trying to think of an example. But again, well, we could go back to the peripheral neuropathies, and they might notice that the patient is dropping things a little bit more. And that could be a sign that they're losing a little bit of sensation in their fingertips. So something like that, having them involved. Having said that, I do want to repeat that again, the patient drives their care and they should be in charge of their care. There are some patients that don't want to talk about things. They want to let their caregiver kind of run the show, if you want to say that. And that's okay, as long as everyone is on the same page and everyone agrees to that. But absolutely, the caregiver is a very important part of helping with the patient during their treatment.
When it comes to caregiver stress, and you mentioned a couple of options they have to manage that, what have you seen them do yourself? What kind of options they seem to be going for?
Well, and I think it's interesting because there's a lot of resistance. Caregivers feel guilty. They don't want to leave the patient. They don't want to just go out and do something for themselves. So it's really funny. I use the getting her hair done because I can think of somebody in particular, and she said, I finally did it. I went and got my hair done. And for her, that just it rejuvenated her. So I think it's whether they're getting their nails done or if for a gentleman, if it's, playing a couple rounds of golf with their friends, again, you need to not feel bad about that. Maybe a neighbor can, if you don't want to leave the patient or your loved one at home, have a neighbor come over and just try to get out for a little bit. And I'm telling you, it will really help things along.
I think that's what's called respite time. Am I correct?
Yes, yeah. Absolutely. Yep. Mm-hmm. There's actually some different organizations that will provide respite care. So meaning that they'll provide someone to actually come in to the house to kind of watch your loved one while you're able to go out and do what you need to do.
Well, Nancy, we've learned a whole lot from you in this discussion. Just to summarize, could we just go over a couple of your most important points about just what we've talked about? We talked about the treatment scenario in the room with the doctor and the treatment team. Mm-hmm. We've talked about side effects, and then we've talked about the important role of the caregiver. So if there was one thing you'd like to leave for listeners to remember from this wide-ranging conversation, what would your message be to the patient who's just been diagnosed, has never heard of the disease, and their caregiver who's just there because they've come along? What would you want to say to these people? And you do it all the time, I'm sure.
Yeah, I think that the biggest thing is I would just to take a breath, just breathe. Let's take one step at a time. Let's talk about your diagnosis. Let's talk about your treatment. Let's talk about your side effects and move forward one step at a time. And this is a journey. You're going to start your journey with learning, and we're going to be with you all the way through it. We want to know what's happening when things change, and we want to get you into your survivorship. So moving forward. As far as caregivers, again, I would just say to take care of yourself, and thank you for everything that you do.
Well, thanks, Nancy, for everything you've spoken to us about. So, over to you, Tricia.
Thank you so much, Nancy. And thank you, Bob Burleson, our communications manager.
Thank you.
for your time and insight today. Remember that our helpline is here for you. The AAMDSIF helpline is 800-747-2820, option 2, or you can email help@aamds.org. To connect with our peer support network, community support groups, and online communities, you can call that number, and you can find us on the web at aamds.org. We'll be here next time. We'll be covering both general and highly specialized topics to assist patients and families coping with bone marrow failure disease. We'll see you next time. So long.